Alcohol contributes to 100,000 deaths annually, making it the third leading cause of preventable mortality in the United States. In this video, you'll learn the signs, symptoms, and health risks associated with excess alcohol consumption and its long-term effects. In America, approximately 4 million women and nearly 10 million men are problem drinkers. Although prevalent, alcoholism is one of the most difficult diseases to diagnose, yet one of the most treatable. Alcohol addiction happens gradually, and people afflicted with it are often in denial that they have a problem.
We understand now that addiction is a brain disease. When somebody has addiction to alcohol or cocaine or marijuana, one of the hallmarks is that they have trouble consistently controlling how much they use. So they use even more than they plan.
Alcoholism can be broken down into two basic phases: problem drinking and alcohol addiction. Alcohol abuse is defined as having unhealthy or dangerous drinking habits, such as drinking every day or drinking too much at a time. Alcohol abuse can harm your relationships, cause you to miss work, and lead to bigger problems, such as driving while drunk.
More people die from alcohol-related injuries than die from alcohol-related illnesses. And so one of the big health problems with drinking to excess is trauma, falls, vehicular crashes, even gun violence, domestic violence.
Alcohol dependence is when the abuse has gotten so out of control the body is addicted to alcohol. One feels such a strong need or craving to drink that they feel alcohol is needed just to get through the day.
Even a heavy drinker may drink in a way that's unhealthy for them, but it may not be that alcohol takes the place of everything, takes the place of friends, recreation, and becomes the #1 focus of their lives. And that happens with addiction.
Causes that can lead to alcohol dependence are a person's emotional state or certain psychological factors, such as stress, anxiety, or depression. And there are even links to genetic factors that may cause a person to be more susceptible to addiction.
It's been pretty well demonstrated now that about 60% of your risk of having alcoholism or drug addiction is really due to genetic factors. 40% is not. So people will develop alcoholism without having a family history.
People tend to drink in excess when they have too much stress, are drinking to avoid problems, or to block out a traumatic situation. Studies have shown that certain stress hormones may be associated with alcoholism. Alcoholism not only results in social and relational problems, but heavy drinking can also lead to serious health problems. Alcoholics can suffer permanent damage to their liver, nervous system, brain, and heart. Some diseases associated with chronic drinking are cirrhosis of the liver or pancreatitis, high blood pressure, osteoporosis, certain types of cancer, stroke, gallstones, and Wernicke-Korsakoff syndrome, which is a serious brain disorder in excessive drinkers that results in blurred vision, rapid eye movement, difficulty walking, and memory loss.
Many people with alcohol addiction have a physical dependence where they get sick from not drinking. Stopping drinking is dangerous for them, and that's why they need medical care to help them safely get off the alcohol and not have things happen to them like seizures or even death.
If the disease is in a prolonged progressive state, drug therapy may be used to treat the symptoms. Certain medications such as Camprol, naltrexone, or Antabuse can be given to help ease cravings for alcohol. For cases of severe or chronic alcoholism, a patient must go through a complete detoxification treatment before any prescription drugs or other forms of therapy can be given. Detoxification is undertaken in an inpatient medical facility under the supervision of certified medical personnel. During this stage of addiction, physical symptoms such as shaking or tremors, headaches, vomiting, sweating, restlessness, loss of appetite, sleeplessness, delirium tremors, hyperactivity, and convulsions may be present. Alcohol detox completion can take from 3 to 14 days, depending on the severity of the disease.
But there are medical treatments, there are medications even that you can take. And the pharmaceutical manufacturers are figuring out that this is a really common illness, and if we can find a medicine that's really going to help, it's going to be a breakthrough.
While therapy and treatments are effective, alcoholism is a lifelong process of maintaining self-control and seeking support from others who can help alcoholics deal with the emotional factors that can lead a person to drink. Although there is no cure for alcoholism, it is quite manageable and, if caught early, severe health effects can be prevented. Treatment for alcoholism depends on the severity of the disease. Most people can receive counseling or behavioral therapy. Programs such as Alcoholics Anonymous can offer treatment to individuals as well as family members who have been affected. If you'd like more information about alcohol and its effects, here are some helpful websites.